Welcome to Creating Presence. I'm Dr. Sandra Bloom, and I'm here with my co-host, Sarah Yanosy.
Hi, Sandy. Hello, everyone.
Hey, Sarah. Sarah and I have spent the last 25 years working with leaders across the US and around the world to build trauma-informed workplaces and to transform service delivery for nonprofit, government, and for-profit organizations that exist for the purpose of helping people. In this podcast, we share our insights and our experience and our knowledge in the hopes of inspiring leaders and other professionals to put these ideas into practice.
Today, we're going to focus on grieving and the losses that are associated with coming to terms with childhood abuse, largely because there's so little conversation about all the things that people lose as a result of maltreatment as children.
Yeah, when someone close to us dies, there's a general expectation that people are mourning and that there is a process of grieving. Death itself presents a tangible and a comprehensible loss. Everybody goes through it. And throughout history, cultures have built traditions and customs to provide a passageway for the bereaved that enables us to let go of those people that we love who have died, in order to allow us to have the psychological space to create new attachments.
But there are lots of other kinds of losses that exist that, exist in addition to those that are about death. A common denominator among the thousands of adults that have been treated for problems associated with childhood abuse are what we call the little deaths. They include things like the loss of hope, of innocence, of love, and joy.
Yeah, the sources of grief are already established assumptions and beliefs that can instantly be gone as a result of experiencing abuse as a child, the beliefs about self and home and family and safety and society. And for others, it's the assault to their integrity that began when they were so young that they really didn't have any time to even develop a coherent, assumptive world before their lives were shattered.
Yet when someone dies, we have all of these, normalized ways of supporting people, right? I think about like we bring food to their homes, we attend services, funerals, all of that kind of stuff. But we do it publicly. But for people who have been abused as children, there's often this secrecy, this silence, isolation that happens in that grieving process. So though because so many of those losses that are part of childhood maltreatment, those losses are cloaked in silence, we don't have ways of really recognizing them. And we certainly don't have processes for grieving them.
And worse yet, these losses are often unaccepted, rejected, denied, and even stigmatized. And we call them the little deaths, right? Because they remain as kind of like unremoved splinters in the person's psyche, sometimes for decades. And they're a major cause of what then gets diagnosed as depression and anxiety disorders and all kinds of labels from the diagnostic and statistic manuals, including problems with aggression. And although each person might develop protective psychic tissues, if you will, over those wounds, and new experiences may allow the child or the growing child into an adolescent or even into an adult to develop different assumptions about the world that contradict those traumatic and abusive experiences. that doesn't just automatically remove those psychic splinters, and they may surface again at any point, including throughout adulthood, often getting triggered by some new insight, some insult to their well-being, some new bad thing that happens.
Yeah, I think it's really complicated too when we think about child neglect, right? When we think about this construct of child maltreatment, abuse is in one category, but neglect really offers these particular challenges for adult survivors because they have to grieve for things they never had, and therefore never had a chance to lose. In the course of helping survivors, we've learned about how difficult it is to form healthy attachments as adults when your childhood attachments have been so scarring that the pain of the past really continues into the present.
Yeah, kind of all that we're talking about today really comes under the heading of attachment theory. And our growing understanding about the impact of trauma and traumatic grief has really provided ways to understand how trauma and loss in childhood affects and often determines adult relationships and impacts the capacity to grieve for new losses. So all that the survivors taught us has helped us to understand loss through the eyes of the children that they once were.
Yeah, those survivors have really taught us about the difficulties they encounter in grieving for the omissions that accompany child neglect, as well as the more flagrant commissions of physical, emotional, or sexual abuse.
Yeah, if we focus on attachment and grief, the losses that accompany childhood exposure to terror and violence can really only be understood within the context of attachment theory. And one of Dr. John Bowlby's great contributions was to recognize that attachment behavior is a fundamental part of our built-in evolutionary heritage, and therefore it's critical to survival. Primates, including humans, need to attach, as he said, from cradle to grave. And any disruption in normal attachment relationships, particularly those that have been established in early childhood, is likely to cause developmental problems that may be quite serious.
Yeah, Dr. Bowlby talked about pathological mourning. When the mediating responses of attachment behavior get activated in a child, right? I think about for my little toddlers, that means crying, running to the door, calling for mommy. But that the attachment figure continues to be unavailable. Like, I leave for work every morning and that stuff happens. But I come home every day. And when I'm home, I'm present and I'm available. But when this doesn't happen, or, it's not consistent, or, the parental figure, the attachment figure isn't present, it really seems to have a lot of relevance in developing personality later on that's prone to depression or other psychiatric illnesses. And he calls this the sequelae of pathological mourning, right? The stuff that follows from these experiences.
Yeah, if the listener wants to see how powerful that is, go on YouTube and look and put in the still face experiment, right? When a mother just doesn't react to an infant for 20 seconds and how disturbing that is to the child. And then you think about that happening over and over and over or permanently to a young child. And it really gives you a perspective to understand how important this information is for parents and for child rearing. Dr. Bowlby identified four main variants of pathological responses by bereaved adults. The one was anxiety and depression, which he saw as the persistent and unconscious yearning to recover the lost person that was originally adapted when the person was an infant, because it actually produced strong motivation for reunion. Because what does a baby do when mom turns away? Starts to cry and then starts to yell. And the idea is to bring mom back again because I need her, right? Totally makes sense. Number two, he called intense and persistent anger. And this is about reproach that's expressed towards others or the self, and it was originally intended to, again, achieve reunion with the lost relationship and to discourage doing that anymore. The third is absorption and caring for somebody else. So somebody who has also been bereaved, sometimes, however, amounting to a caregiving compulsion. So not caring about oneself, but just caring for other people because it keeps you away from experiencing the feelings of loss in your own background. And the fourth main variant he talked about was denial, that the relationship actually is permanently lost.
Yeah, and since Bowlby made these observations, other clinicians and researchers have been extending his work to show the relationship between disrupted attachment in childhood as a result of maltreatment and the development of adult pathology. As far back as 1963, Kahn discussed the idea of cumulative trauma and the impact of protective failures. And he says cumulative trauma is the result of breaches in the mother's role as a protective shield over the whole course of a child's development from infancy to adolescence. Um, and he went on to talk about how this leaves a person vulnerable to significant problems later in life.
Yeah, it's really well established that there is a connection between childhood loss and depression and between suicidal behavior in adolescents as well as adults and disrupted attachment. So in the last decades, lots of research has made concrete the relationship between insecure forms of attachment in childhood and the evolution of personality disorders as well. So, Sarah, of the adult patients we treated in our inpatient program, most of them had been victims of severe physical, psychological, sexual abuse, and neglect. And some had experienced only one form of child maltreatment, but many had experienced two or more.
Yeah, same in my practice and experience. And childhood maltreatment's associated with a wide variety of physical, psychological, and social dysfunction in childhood and in adulthood. And there's now a significant body of literature reviewing pretty well-established connections between chronic depressive disorders, somatization disorder, which is when you start to experience physical symptoms in your body as a result of your psychological distress, anxiety disorders, and lots of personality disorders, especially borderline personality disorder, and childhood exposure to overwhelming traumatic events. So that seems to be a common denominator in
Yeah,
all of
many of the patients we see in our treatment carry two, three, or even more psychiatric labels. Many of the same diagnostic categories that have been implicated as the long-term results of disrupted attachment relationships. And in many ways, trauma-related disorders are disorders of disrupted attachment.
Yeah, it almost makes more sense to think about it as, complex post-traumatic stress disorder. Um, and I think it makes sense because research shows us that there's a really significant difference between survivors of disasters, like discrete events that end, and people who suffer from post-traumatic stress disorder uh, because they experienced childhood maltreatment, right? That betrayal trauma, that chronic exposure over long periods of time.
Yeah, and these differences can fall into seven major categories of problems. So, alterations in regulating emotional arousal, the whole issue of chronic hyperarousal, alterations in attention and consciousness. So all the stuff about dissociation, somatization, experiencing all kinds of physical symptoms and chronic health problems, alterations in self-perception, the way the person really looks at themselves, alterations in, this is really interesting, perception of the perpetrator. So really confused ideas about who those people were who hurt them. Alterations in relation to others as a result. It's pretty hard to trust other people as you grow up if you've been hurt as a young child. And related to that, alterations in systems of meaning. And together, these symptoms, as you pointed out, were often seen as similar, had a lot in common with PTSD, and yet were far more complicated. And that's why we began to really call this complex PTSD. And these symptom clusters have been really demonstrated to differentiate from acute adult onset single incident trauma syndromes from adult victims of childhood interpersonal violence and abuse.
Yeah, if we look at the literature on grief, we see that difficulties with managing emotions and alterations in attention and consciousness might actually reflect two of those final adult personality outcomes of what Bowlby was describing as pathological mourning. The first is the unrelenting yearning and searching for the lost love relationship. And the second was the defenses that people build up to protect against that yearning. We can see those two things as the underpinning for lots of the symptoms that people experience that then drives them to seek treatment.
Absolutely. And then the persistent anger and reproach that Bowlby talked about originally was intended to get mom to come back, to achieve reunion, and to discourage her from separating anymore. Hugely common problems for survivors in all their relationships. And then alterations in self-perception color all that for the perception of the perpetrator and in relationship with others really can be understood in the context of an expectable developmental outcome in the face of early disrupted attachments.
Yeah, that stuff about how we view the perpetrator, it's so interesting. And when we look at studies of people who have been captive victims, so political prisoners, torture survivors, hostages, and both adult and child victims of family violence, when people are placed in situations of inescapable danger for prolonged periods of time, they develop a weird reaction that we call trauma bonding.
Trauma bonding, it is, Sarah, it's a weird thing until you understand attachment. It's a relationship that is based on terror and the twisting and manipulation of normal attachment behavior in service of somebody else's really malevolent intent. So people who are terrorized experience the perpetrator as being in total control, the source of pain, but also the source of pain relief when they stop. So the source of threat also becomes the source of hope. And that just twists up our normal attachment systems. So victims come to internalize the experience of helplessness and the role of perpetrator. And then later in life, unconsciously recreate the pattern of these early and traumatizing relationships in new relationships unconsciously, and can be disguised, but it's what we call traumatic reenactment, which is really disturbingly common. And successful grieving means letting go of these patterns as well as letting go of the former abusive relationships, even though those relationships may also be associated and arouse a deep sense of fear and foreboding at their loss. And this is all part of the picture of trauma bonding.
Well, and that's what makes it look weird to people on the outside and makes it feel weird for the person who's experiencing it, because it is, from an oversimplified perspective, it's easy to say, like, well, just leave your abusive partner, or, just get out of the relationship. But it's so much more complex than that. It also is interesting because it shows up in our relationships, but it also shows up in our bodies. And somatization, right? That kind of experience of having physical pain symptoms, that may represent not just the effects of prolonged stress on the body, like, the hormones and the muscle tightness and the things that sort of make sense from a physical perspective, but we also might be seeing the effects of suppressed grief on the body. We know from the original ACEs study, and all the research relating to it, that there's a graded relationship between the number of categories of childhood exposure and each of the adult health risk behaviors and diseases that were studied, which represent the most chronic illnesses that cost adults so much, like ischemic heart disease, cancer, chronic lung disease, skeletal fractures, liver disease, all of those
Yeah,
that connects in our bodies.
there's now a huge body of literature that connects um, the women who have had childhood adverse experiences with problems of physical health. So a history of child maltreatment significantly associated with a whole lot of physical health outcomes, all the ones you've mentioned, but also including perceived poor overall health, greater physical and emotional disability, increased numbers of distressing physical symptoms, and a greater number of health risk behaviors.
Yeah. So we've highlighted the situation of child maltreatment, and these grief responses, pathological grieving on our relationships, on our bodies, but also it shows up in disrupted systems of meaning, right? Like how we think about the world. Um, when people have grown up with intimate childhood contexts of mistrust, deceit, hypocrisy, cruelty, that are embedded within the larger social construct that actually says the opposite, that children are supposed to be valued, loved, cherished, protected from harm. When our experience doesn't match what the world tells us is supposed to happen, it creates enormous conflict for how we think about ourselves and the world.
Yeah, I mean, this should totally make sense to people. A child's exposure to deliberate malevolence at the hands of somebody who's supposed to love and take care of them powerfully confuses the ability of the child to correlate his or her or their own experience of reality with the realities of other people. And the contradictions are just shattering.
Yeah, and it messes with the sense of justice, right? So this idea of what is right and what is wrong, and how do I right what has been wrong? Sometimes it really messes with a child's sense of reciprocity, and can drive them to seek justice for themselves. And sometimes that looks like revenge against themselves or against others or both.
Yeah, when children discover that the adults who hurt them have not and will never be held accountable for the influence that has so negatively harmed them and will not be held accountable by the society. Not only does this cause disruption in the attachment relationships with the perpetrators, but also with the sense of self and the other members of the family and society at large. It's really hard to make sense out of it. Dr. Charney points out, he wrote, the avoidance of defining perpetration of evil as a disturbance in its own right reaches its bizarre extreme in the classic literature on child abuse, violence to the child. According to the prevailing definitions, the majority of parents who abuse children are not emotionally disturbed. It is utter nonsense to ignore the fact that anyone who seriously abuses his or her child is seriously disturbed.
Yeah, so the losses associated with childhood abuse are extensive, and children who were mistreated and who've grown up into adults that often lost their ability to manage emotions, and they don't feel safe. Like they haven't ever really experienced true safety. Mourning for what they've lost is incomplete, and they often don't feel whole. They have difficulty establishing safe and trusting relationships, or they feel like a meaningful part of the community. They don't feel that sense of belonging that most of us do.
Recovery from loss requires the working through of a grieving process that includes some really necessary tasks. Mourners have to be able to express their emotions. They have to understand the meaning of the lost person or object. They have to be able to surface and work through any ambivalence, because close relationships usually contain ambivalence. All of which, if they can do this, will eventually free them up to attach trust and love to new significant others and find appropriate replacements for the lost relationships.
But there are also other ways that people can help heal. And when we come back from our break, we'll talk about what those look like. Thanks so much for listening to Creating Presence. We'll be back after these messages.
If you want to develop a trauma-responsive culture within your organization, your leaders must be able to be knowledgeable and possess the skills to create positive change. Creating Presence, developed by world-renowned Dr. Sandra Bloom, offers an online training and coaching process that will help leaders become capable to cultivate a safe, productive, and values-aligned environment for your staff and clients. For more information, go to www.creatingpresence.net. Creating Presence is managed by Lakeside, your resource for trauma-responsive care.
Welcome back to Creating Presence. I'm Dr. Sandra Bloom, and I'm here with my co-host, Sarah Yanosy. We're going to continue our discussion now about working through the losses associated with childhood maltreatment that are frequently called complex PTSD. Now, I love Shakespeare.
Me too.
And in the play that you're never supposed to mention if you're an actor, but I'm not an actor, so we're talking about Macbeth. Macbeth said, "Give sorrow words. The grief that does not speak whispers the o'er-fraught heart and bids it break."
Yeah. When we don't give words to our grief and loss, our hearts stay broken. You know, for centuries, we have relied on, what we call the Cartesian mind-body split, like thinking about our psychological processes as completely different from our biology or our bodies. And finally, I think, this way of thinking is coming to an end. A growing number of researchers and clinicians on both sides of the Atlantic are investigating how the workings of the mind, most particularly our emotions, impact our health.
Yeah, for those of us trained during an era when psychodynamic thought was more prevalent than it is today, at least in the United States, much of this research may bring responses that certainly I have had, like, well, I told you so,
Same.
right? Because in our program, when we had an inpatient program for 20 years, we had psychodrama 3 times a week. We had art therapy. We had movement therapy. So the nonverbal approaches were really dominant. And in part, the rise in the public interest in alternative medicine and those long-standing clinical insights that predate the present are actually gaining more and more empirical support.
Yeah, and it's really satisfying validation for those of us who are psychotherapists, but it also provides a really good argument for continuing to promote the study of writing, composition, and the language arts in schools and in other settings as well.
Yeah, because anybody can do this. It doesn't
Yeah.
require special training, right? Some of the most interesting work has come out of the research of James Pennebaker and his colleagues who have been working on this since the 1980s and been looking at the relationships between physical health and emotional disclosure through writing. And now covering over 800 subjects and 13 separate studies of healthy people, a meta-analysis confirms that emotional writing about traumatic or highly stressful events does produce significant health benefits.
Yeah, so let's talk about how they did this experiment, how they got to these results. The basic format was that subjects were asked to write for 20 minutes on each of 4 consecutive days about a particular subject. And they were cautious about confidentiality and protecting that. The only rule that they had was that once the subjects began writing, they couldn't stop and they couldn't have any concern about their spelling, their grammar, their sentence structure. None of that mattered. The control group was asked to write about a superficial topic, something like, describe your plans for the day or describe the clothing that you're wearing. The experimental subjects were asked to write about the most upsetting emotional experiences of their lives.
And even the investigators were surprised about their findings. In study after study, the subjects in the experimental group writing about their really difficult life experiences, they suffered from significantly fewer illnesses and showed improvement in their immune system activity for months after this brief 4-session test.
Yeah, college students that they used in this experiment found that their grades improved. Employees were absent from work less. People who'd been laid off from work found new jobs more quickly. And even when they did this with maximum security prisoners, they found that they were less likely to visit the infirmary after they did this writing experiment. And some research in New Zealand even revealed that immune processes are changed within minutes of emotional disclosure.
So, in reviewing this rather startling data, hypotheses are being developed to explain such dramatic physiological and behavioral responses. It's well established that every emotion, right, provides a different pattern of arousal of the autonomic nervous system. One idea is that stress, in activating the complex human stress response, produces many kinds of powerful neurochemicals, including cortisol, which is a very powerful suppressor of the immune system.
Yeah, so the thinking is that the energy that's being used for like chronically inhibiting negative emotions, like keeping that stuff at bay, produces a lot more work for the autonomic nervous system. And that this increased load, this workload on the autonomic nervous system functions as a chronic stressor itself. So that results in the biological survival systems that really should only be turned on under emergency conditions are basically set to on all the time.
Right, exactly. And relieving this chronic inhibition through emotionally expressive writing takes the pressure off of the autonomic nervous system and the body functions that it controls, which is pretty much all our body functions. But the positive effects of writing do not appear to be entirely due to a reduction in inhibition, nor are the positive health effects of writing overridden by having verbally disclosed to another person. So there may be something very particular and important about the writing function itself.
Yeah, we also understand that, traumatic events fragment mental functioning. So, we see that people have a hard time processing, organizing, and integrating their traumatic memories because those memories don't always have a verbal component. So this finding has gained some support by neuroimaging studies. And those neuroimaging studies demonstrate a decreased activation of the brain's speech center when a traumatic memory is evoked, with a simultaneous increased activation of visual and other sensory centers. So say that again in, easier terms. When there's a traumatic memory, the part of the brain that deals with speech less activated, the part that deals with visual or sensory experiences lights up like a Christmas tree.
Exactly. And then that's the notion that people probably have heard of speechless terror, right? That's where it comes from. The lack of verbal encoding of an experience means that it actually can't be thought about. It cannot be shared. It can't be placed into a coherent narrative. It's just kind of out there, and therefore we can't actually make meaning out of it. This may be due to a real problem because for us, more than for other animals, really, because our left and right hemispheres do such different things. So for most of us, our left hemisphere became specialized for language, and our right hemisphere does all of the visual, experiential kinds of memories are there. And so it may very well be that at the time of a traumatic event, speech is turned off and our earlier, more primitive way of being and thinking that is dominated by our right hemisphere kind of takes over. And so it means then that writing involves both hemispheres, because to write, you have to use those language skills, but you also have to use all those visual, spatial, and behavioral mental schemas to write. And so you're getting to a memory and emotion and helping us to process the trauma and the emotionally charged information and the memories in a way that very possibly no other real human skill can as easily do.
Well, so if we think about that from an evolutionary perspective, right, it makes sense that humans have evolved these, abilities to speak, write, create art for important biological survival reasons, right? They're not just fun or, as people who are, wanting to cut arts programs in schools, not seeing any value in it. There's evolutionary value in our survival. And those of us who love literature and love reading, that's us for sure, Sandy. we've always known how important novels and poetry and plays are, how they're so important to the survival of our species because they pass down knowledge, wisdom, stories through narrative. And until recently, writing experiments have been carried out on healthy people. Um, but it sort of just jogged my memory about something that I feel compelled to do every time I have a new class of students in my trauma class. I start by asking people to introduce themselves, but then I also ask them, what are you reading or binge watching right now? And I feel like there's something really inherently revealing about what stories people are drawn to, what they're using their free time to connect to, but also kind of reinforces how much value there is in hearing the stories of others, of kind of connecting and learning in that way. Like our stories are so important.
I mentioned earlier that when we had an inpatient unit, so we were treating people, all of whom virtually had complex PTSD. And so we would do a lot of talking therapy with them, but that would only go so far.
Yeah.
That they really needed. So we had particularly psychodrama was incredibly powerful as a tool because it would be done in a group context and people would act out their different, most often most traumatic experiences with other people playing different roles. And they would often be the directors. And that would create breakthroughs that would never happen how long I talked to them
Right.
and work just there, in verbal psychotherapy. So it's really important to have both. And I think it's because it connects those two hemispheres and integrates the two hemispheres of our brain. I want to tell you, though, about an exciting study that was in the Journal of the American Medical Association. This was so dramatic. It demonstrated that after 3 consecutive days of this 20-minute timed writing period that we described earlier, asthma patients showed clinically relevant improvement on spirometry testing during a 4-month period. And patients suffering from rheumatoid arthritis showed clinically relevant improvement in the same period. So it is possible to do really sound and grounded research with these techniques that are really not in common practice.
Yeah. So when we put together all of this research, it really helps us better understand why childhood trauma events are so highly correlated with current health problems, and why recent traumas that are not discussed are linked with increased health problems. And this idea of, connecting our experiences to that practice of writing or of somehow using our bodies to tell those stories, right? You were talking about how it's not the same if we just tell it. There's something about the physical act of writing or of acting it out using your body. And it's really interesting because I was taking a look at an article in Frontiers in Psychology journal with these two researchers, Vanderweel and Vandermeer. And they were actually talking about handwriting versus typing and brain connectivity. So they used an EEG study, and their work was really about kind of learning. That was what they were focusing on. But I feel like there's so much application to what we're talking about, because basically what they said is that it's not the same if you type it. You really have to write it with that graphomotor process. And what they were saying is that just like you are describing, you know, handwriting activates almost the whole brain. So those two systems, the two hemispheres at the same time, compared to typing, which hardly activates the brain in the same way. So when the brain isn't challenged very much, when it's pressing the keys, it's not doing the same work of integration. When it's forming letters by hand, it actually is promoting that integration. And they talked a little bit more deeply about, how writing by hand requires communication between the brain's visual, sensory, and motor cortexes. People who wrote with a digital pen had to actually visualize the letters and then use their fine motor skills to control the movements when they're writing. And so, you have to, when you write by hand, kind of look at the letter A as you're making it, and it looks completely different from the letter B, and it requires a different movement pattern. And it's those two things, the visual part and the movement part of your hand, that activates those different parts of your brain.
Huh. It also reminds me of Dr. Lindra Bills, who's a friend of mine. We worked together on our inpatient unit for a number of years, and she's a psychiatrist, but she developed this technique called trauma art narrative therapy, or TANT. And it's really a very interesting process. I've used it, and we've been in big workshops together and used it actually in a Spanish-speaking country, where we had to communicate. Neither of us were good at Spanish, so and it didn't matter because it's about drawing.
Mm-hmm.
And so she has people draw pictures. So it's somebody who has had a specific traumatic event that's been haunting them. So they might have nightmares or be chronically hyperaroused, or all that goes along with PTSD. And she has them draw the specific event in a specific sequence out of a time sequence, not from beginning to end, but she starts with a safe place before and a safe place after to make sure people are grounded. And then when you knew the bad thing was going to happen, and when you knew the bad thing was going to be over. So again, more grounding. And then you can draw a whole sequence of pictures about the bad thing. And these are not professional artists. These are, my drawings are stick figures. That's the best I can do. But it gets across and she's even done this with one of the people that she did this with was someone who was a former police officer who had been shot in the head. When he and his partner stopped. His partner was killed and he was shot in the head, and so he had severe brain damage and was in a wheelchair. And all he could do he had some function of I think his non-dominant hand, so all he could do was kind of do marks. He couldn't actually draw pictures, but enough. And he still had his speech was still quite active, and so he could describe what it was. And then she would have people, and it worked, and it worked for him. So you can use this even under all kinds of circumstances. And so people would draw the series of pictures, and then she would have them narrate it, and then she would have them write the story, often on the back of the pictures. And it was just amazing how effective that apparently simple process was to help people to heal, to integrate, to stop having the nightmares and the flashbacks. And she would one of the instructions she learned was to use a fat marker, not a thin marker or a pencil, because if it was a thin pencil, people would often become too fixated on the details of the pictures and trying to be really realistic about what they were creating visually. And that's really, she saw that as a form of dissociating from the emotions, right? And so I think you're right that writing is different because words are representative of images in a different way to images of a traumatic experience. And that's what partially makes it so powerful.
I was thinking about just how this idea of, really making the connection between our bodies and a representation of what's happened to us. It's now got some real traction in terms of, the research, but it's sort of based on ancient wisdom. And I think about a lot of the healing work that's been in existence from communities that didn't have words for any of this. Rituals around dance and representational artwork on cave walls. I've actually been talking a lot with my brother, who I think I've shared has a completely debilitating immune disorder, and he's actually been working with someone who does energy work. And I have to tell you, like, I'm all for it, and I was shocked because my brother is not anyone who would ever like given any credence to energy work. But I think what's so powerful about it, now he'll say, oh, maybe it's the placebo effect, and I don't know. But he's really seeing a lot of results. And I think the reason is that our friend Vani, who does this energy work, what she's describing as she's doing it is releasing trapped emotions from different parts of the body. And just having this sort of awareness that our emotions, our experiences live inside of our bodies. And the idea of them being trapped there and needing to release them is really powerful. It's also really interesting that my brother's been doing a lot of writing in this process too, which I think, there's so many different ways that we can access this understanding about integration and healing and how our brains use the process, whatever it is, to do that integration work.
It also, I think, speaks to how society has so influenced, particularly males in our culture, to inhibit all those feelings of loss and grief and sadness,
Yes.
and only be able to channel them through aggression and anger and violence. So it's not a surprise that we be living in the culture we're living in as a result when we understand all this. And I also think what's so important is that anybody can do these things, that when our mental health techniques, our services are unavailable or overwhelmed after disasters or wars, well, there are things people can do for themselves to help themselves heal and to take care of their bodies and help their bodies heal. And we encourage everybody to go to the theater, go perform. Any kind of creative expression can improve your health.
Even binge watching.
Even binge watching. Or coloring.
Yes, coloring, right? Connecting to stories, others and your own. Thanks so much for listening to Creating Presence. Join us next week when Sandy and I will talk more about what it means to create a healthy society. You can reach us at creatingpresence.net or voiceamerica.com. See you next week.